Good evening. Our mission at the onset of this assignment has been to recommend changes that will allow Pifer to regain their public's long-held reputation of an institution that provides quality care and a safe environment for its patients. Today we'll take a look at performance analysis, recommended interventions, evaluation plan, and a change management plan, in some concluding words. We investigated a dangerous issue Pifer General Hospital has been experiencing. Pifer General Hospital has received a considerable number of complaints and lawsuits about medication distributed in error in their hospital. The challenge for Pifer is to eliminate these errors and return to their long history of providing quality care in a safe environment. These changes will impact the community in which Pifer practices, benefiting all the patients, the staff at the hospital, as well as Pifer's reputation in the community. Our analysis of the performance of Pifer General Hospital revealed four main gaps. Let's take a moment to review these gaps and their causes. The first gap is that mobile technology is not being utilized fully. We believe this is caused by senior nurses, supervisors, and managers in two units who are uncomfortable with the new system and are really resistant to implementing it in all situations of patient care documentation. The leaders of these two units are purposefully instructing junior nurses to use both systems. We see evidence of this in interviews which show us that low-performing units are using a two-system method to track patient interactions, while high-performing units are using just the mobile technology. Junior nurses who are familiar with the mobile technology because of higher education say they're just following what they're told to do by their supervisors, including following their orders to use both systems. Interviews with senior nurses and supervisors confirm they are instructing junior nurses to use two systems. We conclude then that senior nurses, supervisors, and managers of the low-performing units don't want to strictly use the mobile technology, nor do they see the value of the system in terms of patient care. And then you have junior nurses in these units that are only doing as instructed and use both systems so that they're not punished for not following their supervisor's instructions. The second gap we see is medication error. We see the cause of this because nurses in low-performing units are administering incorrect medication, incorrect amounts of medication, and administering medication at incorrect times at a higher rate than in high-performing units, indicating that there are not consequences for being uncompliant or non-compliant with Pifer procedures in two low-performing units. We see evidence of this in nursing reports, which document twice the number of medication incidents in the low-performing areas 2 years ago compared to the high-performing areas. And then even after training, the low-performing units doubled their number of incidents from the last 10-year average, while high-performing units experience less than 10% of the total complications from medication errors. We conclude that there are no consequences for noncompliance with Pifer procedures or there are no preventative measures taken in order to ensure a decline in medication errors. The third gap is staff turnover. We believe the cause of this is a difficult unit culture consisting of poor attitudes by senior nurses, supervisors, and managers, as well as confusion on how junior nurses should be doing their jobs. And we believe these are disincentives to retaining employment with Pifer in these two low-performing units. Our evidence shows in interviews that senior nurses were almost defensive about how to use and implement the mobile technology, and they refused to learn from staff nurses or those junior nurses. In fact, they even feel almost threatened by the thought of being asked to stop using their paper file method that they've become accustomed to using. Junior nurses really recognize this negativity in their interactions with senior nurses and supervisors and managers, and it makes them reluctant to ask for assistance themselves or ask for clarification about their roles and ask for help with patient care. We conclude that junior nurses are not motivated to stay employed with PIFR, causing an employee retention problem. This really compounds the gap then, as more new nurses are being trained by these old disenfranchised supervisors and managers. And because of that, they feel much more pressure to hurry up and train, and so they continue to use two systems because it's easier for them to use and easier for them to train. And the fourth gap we see is patient satisfaction with care from nurses. We believe this is caused by the fact that mobile technology is not being used to the benefit of the two low-performing units. Using two systems to document patient interaction requires more time to perform administrative tasks, so that leaves less time for patient care. Our evidence shows this in patient satisfaction ratings because they correlate to the performance levels of the units. Low-performing units received a 3.4 rating in patient satisfaction on a scale from 0 to 5, and they're using two systems. High-performing units received a rating of patient satisfaction of 4.7, and they only use one system. We conclude then that not fully utilizing mobile technology, as these senior nurses and managers have been instructing, forces the junior nurses to spend substantial time on the paper files and kind of trying to understand when they need to use what. And this compromises the time spent in caregiving, and it wastes really precious energy they could use to improve patient satisfaction. In order to realign the nursing staff's efforts with PIFR's mission, vision, and values, we recommend the following interventions. First, implementing a reward system. This is done to change and reinforce the behavior of using the mobile technology system. This could be based on file audits or high patient satisfaction and delivered in the form of public recognition. This encourages more confidence in the junior nurses' use of the mobile technology and in their patient care. And it instills a sense of pride for all the units' implementation of the system. Next, implement team strategies to encourage trust and collaboration and openness among the low-performing units. So senior nurses and nurse managers are collaborating with those junior nurses to improve communication about and the ease of implementing any new systems, processes, and procedures. Next, implement preventative maintenance measures in order to improve the quality of patient care. This could include a monitoring system to ensure procedural compliance, as well as maybe stop points if an incorrect procedure is attempted to be used. Standards are met, procedures followed, and patient care improves. Next, provide timely feedback for junior nurses. This would be structured in a system where supervisors and managers would use this to appreciate the junior nurses' behavior or change their performance. This will increase junior nurses' confidence in their performance and encourage them to retain their employment. Next, implement management and supervisory development programs in order to train unit supervisors and directors skills such as coaching and mentoring and change management for the managers, and then setting objectives and planning work and motivating staff and providing feedback for the supervisors. We also recommend developing cultural intelligence in order to improve the culture of all units, a culture where collaboration and open communication makes all employees feel valued and really want to retain their employment. And last, utilize performance management across all units. This will bring consistency in the PIFR nurse role and its duties. This will afford all units the opportunity to define the performance they'd like to see, like set the bar, and then through scheduled evaluations, monitor the performance to ensure they meet the standards consistently. Then this will also provide data to supervisors and managers who can then use that to make decisions about staff, including training and reward and promotion. We have determined that we will evaluate our plan for intervention and will measure success in the following ways. Regarding the reward system, after 6 months, we'll use file audits and review data to show that 100% of all patient interactions are documented using the mobile technology. For the team strategies, after 6 months, all nurses will be observed assisting each other with processes and procedures and implementing new systems. Regarding preventative maintenance measures, after 6 months, nursing reports will be reviewed and will reveal an increase in the percentages of cases where correct medication was administered. For the feedback system, after 1 year, staff turnover in junior nurses will be less than 8%. After management and supervisory development programs are implemented, we will review after 6 months to make sure that supervisors and managers will be providing regularly scheduled documented meeting sessions with staff nurses to provide the coaching and mentoring and development they need. Regarding cultural intelligence, after 6 months, the cultures of these units will allow them to effectively plan their workload and organize resources because of their comfort with their strengths and how they've overcome their weaknesses together. And for performance management, after 1 year, there will be an increase in patient satisfaction as revealed in patient surveys. We will support this proposed change management using Lewin's change management model. The focus of this model is to look at change as a process with distinct changes, and these stages are called unfreeze, change, and refreeze. We will prepare for each stage of change and understand what's coming and manage the transition then. In conclusion, there are 2 very strong themes in this PIFER case. First, increasing leadership skills will increase employee retention and create a culture and environment that is open and collaborative. And second, adhering to established policies and procedures will lessen medication errors and increase patient satisfaction. Managing the changes in these key areas will align all units toward the mission of providing quality care in a safe environment for patients.